Mark, we don't seem to have any sound online.
Does that work any better? No.
Yeah, we can hear that.
Okay. How about now?
Yep, we can hear that.
There's an echo on this road, right? Can you hear me now?
Yep, now we can.
Okay, thank
That's
you.
great. Thank you.
My apologies, but we're able to move on now.
Okay, great. Let's see, where were we? Oh, a motion to approve the minutes.
Move to approve.
Okay, and seconded. All those in favor?
Oh, I'm sorry. Can I check public comment? That's okay. It got interrupted. Is there any public comment on the minutes in the room? And then I don't see a hand remotely. So now all those in favor?
Aye.
Aye.
All right, thank you.
Thank you.
We can move on to general public comment. Is there any in the room? I do not see any, and I do not see a hand on the remote folks. So we can move on to item 4, the executive team report.
Okay. Thank you. Oh, are you? Okay.
Team report. No.
Yeah, executive. team. Did you, were you gonna get something?
I was gonna start. Go ahead.
Sorry, I have a little cold, so my head's not working all that great, so. Diltar, please. Thank you.
Good evening, commissioners. Thank you. My name is Deltar Sidhu, and I'm the CEO and nursing home administrator for Laguna Honda. Nice to be back here again and present all the wonderful work that the teams do, day in and day out. As you have the presentation in front of you.
Yeah, I'm gonna kick us off with something briefly before
Director,
Diltar.
I have a few words to say before I start. Thank you.
So we have some relatively late breaking news that we wanted to share with the commission and the public. As folks know, we have been working hard on the request to CMS for the waiver for the additional 120 beds that are offline, given they are triples, not doubles. I think we've discussed in this commission and provided publicly what I think is a very compelling, strong case in a letter with many exhibits and much evidence and a very strong argument to CMS for why they should approve the waiver. We were notified end of this past week that the waiver has not been granted to us again. There were also some the justification in a relatively short letter back from CMS noted two things. One, it noted historically the large number of incident reports or complaints from the facility as grounds for not approving the waiver. It also invited us, instead of having a blanket waiver, to ask for a waiver on a one-off basis. And I think on both those are very challenging. On the first, we want to be very clear on the record for the public, back to CMS as well, that we have had issues historically at Laguna Honda. Our team collectively, our staff, our nurses, others have worked incredibly hard. We now have 5 stars and have turned around the facility with substantial work from all staff. And when you look at the number of incidents and complaints and you adjust it for the size of the facility, they're looking at absolute numbers. Many nursing facilities have 1 to 200 beds or fewer. We have close to 700. And so I would be the first to say that I'm always very concerned about and want us to be extremely vigilant relative to complaints and incident reports. I also want to be on the record that we have turned things around significantly at Laguna Honda. So I want to make that point on the first piece that CMS mentioned. On the second point about applying on a case-by-case basis for a waiver, practically that is very difficult operationally. When we have a patient who potentially wants to come to Laguna Honda, often they are awaiting step down from an inpatient acute care hospital. It wouldn't be feasible to say, wait, you're eligible, but now we got to apply to CMS and wait who knows how long for an individual approval while that person sits in a hospital bed waiting to be discharged to another place. So that sort of one-off case-by-case presentation is not feasible. So I, number one, want to make sure that the commission and the public have an update on that. Number two, I want to reiterate how important safe, high-quality care is, how proud I am of the work that our clinical staff and our environmental staff and nutrition staff and others have worked to really turn things around at Laguna Honda, and that we want to do everything possible to support it. Third, I also just want to note, in terms of next steps, we debated a few next steps here. This has been a priority for us, and I think we put together a very compelling case for the federal government. We are not conceding on the merits of our argument, but at this point, given what everybody sees on the federal landscape and the number of things we need to be concerned about with, incredibly damaging things and cuts in reimbursement in the Medicaid program that have just been passed at the federal level and other pressures, we want to make sure we're getting back to CMS to state on the record, we think we've turned things around at Laguna Honda, and to put some context on those claims, to note that we're not agreeing on the merits, but we are not intending at this point to pursue further appeals or action, just to be very wise about where and how we're engaging with the federal government, given the magnitude of cuts that are coming all around us at this point, and that we need to be prepared to fight. So I want to give that update. I know this is very important. Our team has spent a huge amount of time working through this. And again, I think presenting a very compelling case. We're very, very disappointed about the decision from CMS, and that's late breaking. So hence I'm noting it. The slides that were posted don't even say this because they were prepared prior to us fully having this information. So with that, I'm going to turn it to Diltar for the rest of the presentation, and I'm sure we'll have some question discussion on this item.
Thank
So
you, Director.
we'll wait
Sai.
for any questions or comments on that issue until the full presentation is. Thank you.
Thank you, Commissioners. Um, as I mentioned, excited to be here and present a snapshot into a lot of work that happens day in, day out at Laguna Honda. To start with a highlight, as you know, June is a Pride Month, and it's a long-standing tradition at Laguna Honda to participate in that, and especially given the light of the federal climate. I just want to say I'm incredibly proud of the staff, our residents and their families and volunteers who work together to participate in this year's Pride event. And thanks to all the teams, activity therapy, and our social workers, and many more who really made the event successful. We're proud of our long history, as I mentioned, supporting our LGBTQ population to let them know that we're here, we're supporting them, no matter what their gender identity or sexual orientation. Now moving on to the next, wanted to provide an update on reopening of South 5. As you know, we're building our census back, and for us to be able to be successful in our goal, we are preparing to open South 5. I do want to recognize that our staff during COVID who provided critical, who played a critical role in managing COVID at a South 5. I just want to say thank you. They did an incredible job at the time, keeping Laguna Honda safe. As you know, our COVID rates were very low compared to the industry. So I want to thank that staff for all the work they have done. And as you know, in the industry, we're getting back to normal. COVID is part of life, and we want to make sure it's incorporated into our regular COVID planning. And we also get back to normal, being able to manage COVID at the home units. So we're working on that and preparing plans, engaged with all the stakeholders to ensure that we can do this in a successful way, engaging with our residents, families, staff, and our union partners for a successful reopening of South 5 towards late July. On going down to the admissions, as I mentioned, for us to be successful in our plan of reaching full census by the end of the year, we continue to do well in that regards. Looking at last almost 7 months, we have averaged around 40 admissions a week, I mean a month. So based on that and our discharges, we are on track to be at full census by the end of the year. I think that's the end of the highlights. If you have any questions, I do want to provide one update that's not here. I'm excited to share some exciting news. Our Jennifer Carton Wade, she is licensed nursing home administrator as of today. So I just wanted to congratulate her on her accomplishment. Thank you. And if there's any questions, I'm happy to answer those. Thank you.
Thank you, Diltar, and much congratulations to Jennifer. And we know that that's only going to benefit Laguna Honda, in ways that we really are going to be able to see in the future. So congratulations. Caesar, public comment?
Is there any public comment in the room on this item? I do not see a hand, but I do see two remotely. Mr. Manetshaw?
Yes,
Okay, hold on. I'm gonna get your thing. Give me 1 second.
it's Patrick Mo. Okay. While you're doing that, my code is BB. As my own.
Okay, please go.
All right, it's Patrick, code BV.
As my overhead slide shows, the pace of admissions to Laguna Honda since admissions resumed still remains dismally slow. As both Dr. Palmer and I have testified, it's unlikely LHH will return to a full census of 706 SNF beds by December 2025. The top part of my chart shows the monthly progression towards returning to having a full census. LHH still has 240 empty SNF beds, and it will take until January 2027 to reach a full census. The bottom chart in my slide shows the referrals for admissions report LHH presented today asserts there has been 262 admissions to LHH since admissions resumed 11 months ago in July 2024. But LHH's slide presented today doesn't factor in there has been a net loss of 117 patients due to attrition, patient deaths, and planned and unplanned discharges. That leaves just 145 net admissions over the past 11 months, for an average of 13.2 admissions monthly, up from an average of 12.6 admissions monthly as of the JCC's last meeting on June 9th. At that pace of admissions, given there are currently 240 empty SNF beds, including the 120 beds still temporarily closed, it will take 18.2 months, at an average of 13.2 net admissions monthly, to return the hospital to a full 769-bed SNF census. It's disheartening hearing Director Tsai. Thank you.
It's disheartening hearing Director Tsai indicate you're not going to pursue a waiver at this point. I want to remind the commissioners and members of the public that since January 1st, 2022, LHH has racked up 704 incident reports in the 3.5-year period. That averages 200 incident reports every year, and we still have 6 months to go in 2025. Laguna Honda staff need to straighten out their work and stop getting so many incident reports. San Francisco cannot afford to lose these 120 beds because of the sheer volume of out of county discharges. You guys need to work harder and get those beds back. Thank you.
All right, thanks for your comment. We have one other hand up. Dr. Palmer,
Oh, hi.
you've got three. Yes.
Yeah, hi.
minutes.
You can hear me?
Yes.
Yeah, this is Teresa Palmer, geriatrician, and I did work at Laguna Honda for 15 years. And unfortunately, your having a full census was predicated from the beginning when you will have a full sentence on losing the 120 beds. And as a longtime nursing home doctor and nursing home reformer, nursing homes are always the low man on the totem pole. And you as the public health department are doing this again by not working harder to keep those 120 beds. The city attorney's letter, David Chu, made a plausible case for litigation around the 120 beds. Litigation does take a long time, so the time to start is now. I realize you have a lot on your plate, but one of the things you haven't done yet is tell us what the out-of-county discharges were for 224, and apparently there's going to be a delayed presentation on that in August. But just the number of out-of-county discharges, I'm sure, will justify retaining those 120 beds. There are not enough nursing home beds for people who need a nursing home bed to grow old in San Francisco. And you need to support the people of San Francisco and the community in saving those beds in their public nursing home. And the time to start is now. Nursing home beds should not be at the bottom of the pile. They should be, they're part of the continuum of care with everyone else. and you do need to try harder. And I'm very disappointed that you're not going to even try. This is a case that can be appealed, and the appeal will take a long time. It needs to start now. Thank you.
All right, that ends public comment for this item.
Okay, thank you. Are there any questions or comments from members of the committee? Yes, President Green.
Well, thank you for the presentation. You know, I read that appeal and I don't know how we could have worded it better or provided more data and more information, visuals and everything else. So, you know, it's very disappointing, but I think that no one could have done a better job and put so much time and effort into this appeal. So it's just disconcerting. I guess one question would be, it sounds like an effort right now, given the individuals in CMS might be challenging, but what would happen if the administration changed? And what if some private entity did decide to bring suit? Do we have any sense for, you know, whether there might be hope in, I don't remember how many days are left of this administration. I used to keep count, but what's, you know, is there any window there? Because it sounds like trying to do the same thing over and expect a different result, given who are the decision makers now at CMS, would be just more disappointment.
I'll take that. I mean, the next step in cases like this typically would be, because we have essentially not accepted no a few times already. Typically in situations like that, you pursue other legal avenues. For a range of reasons and risk calculation with this administration at this point, we've concluded it will neither be, it'll be very challenging on that, but we intend to leave our options open. And I want to be very clear about that. Should there be a change in administration, for example, which is why when we respond to CMS, we would continue to, for the record, state that we believe that the perspectives and data that we put forward in that very exhaustive, clear, I think compelling letter in April of this year continues to be our perspective on our, and to reaffirm that. And so that will give us the option to pick things up at a future point should the federal administration change.
Thank you.
And
Oh, I guess it's working. I needed to get this back, but I don't know what's happening.
I turned it on for you. It's on.
Oh, you did? Okay, thank you, because somehow I was sorry I was still on the full screen. I think that President Green's suggestion also is one that I think we should consider. First, I believe that the rationale offered by the director makes sense in the face of the hundreds of millions of dollars that we're all talking about in the state of California, and the potential of the losses in Medicaid for San Francisco particularly, and with the fact that they have looked at one data point to actually turn us down, I think is telling that the rest of the appeal, they didn't feel that they could actually, or they didn't want to discuss. And as I think you pointed out, you know, the question of incidence, I mean, we have hundreds of patients and most nursing homes has tens of patients. If we're only that, I think also one might want to look at how many of the incidents were appropriately were reviewed and then found to be appropriate or not found to be appropriate. So there's a number of things that you could talk about. But priority at the moment would seem to be also that it's very important that we be in a position that we don't fight too many battles on too many fronts, and that it's important to take the most vulnerable areas we have so that patients who do need care are able to get it that are currently sponsored by the federal government. And so I understand the administration's decision-making here in terms of actively pursuing, which would be then using our legal course again, if that were the tech. And we already know that the city attorney is in many battles at the moment with the administration in regards to some very important care issues. That's not to say that Laguna is not important, and it's not to say that we shouldn't have all these beds, but we have been lacking these for a number of years. I think we all recognize that we should have the maximum number that we can have, and that it's important for these people to be able to access this. But I think we also have to balance that with the fact that we have a large population dependent upon federal support for their health care. And it's a very fine balance where we're going to be able to get back to a full house of what we are licensed for within the coming year, so or less than a year, as you pointed out. So I think that that's commendable, and that we are as quickly as possible trying to respond to the needs of the community. But whether we build 500, 700, or initially had talked about 1,100 beds many decades ago, there's a practical level as to, in the case of 1,100 beds, that we couldn't build it because we didn't have any money. So there we lost out on several hundred beds. At the moment, we're fortunate to be recertified with the hard work that staff and administration has done from a very serious series of issues at Laguna. And we should be then very pleased that we're able to actually even take the 500 plus that we're going to be able to serve. And so I do think that we have a lot of non-government friends at this point. Perhaps the most prominent is former city attorney Louise Rennie. And just as they did before, they may have other ideas in terms of being able to pursue a different course, which was not part of the city when that was pursued. And I would imagine when Supervisor City Attorney Rennie hears about this, and it might be worth discussing with her the rationale also, so that she understands what's really happening, because she is so dedicated to Laguna. There may be other ideas that don't use our city resources right now that could be helpful in terms of having a different outcome. But I think every time you're looking in the papers every day as to what is happening, it does not look like this is one that they would just say, oh, how nice, you guys have done a great job. When in fact, where we're doing a great job, they're even talking about taking it away. So I could understand that rationale, and I'm very disappointed. And I do think that your course at the moment seems very reasonable. Having said that, I'd like to get back to your report also, so that we can maintain the 500 beds. The area I was quite concerned about now is the fact that you're going to open, or you're talking about potentially mixing COVID patients on their regular wards, or continuing to house them on regular wards rather than separating them out. And I'm wondering if the timing is right, because just today they released, or very approximate today, maybe it was yesterday, but I saw the news today, that the wastewater reports in San Francisco and the Bay Area are presumably rising much faster than even the rest of the state. And whether this is the right time to consider cohorting the any COVID patients that you have back on the wards, or you want to wait till this starts to reduce itself. I mean, it's wastewater information. It's not information about, acute cases coming up in the hospitals. We haven't heard that, but it is somewhat disturbing, and I'm not sure we can always count on the media for being accurate, but they do seem to be quoting the state that this is what's happening in the Bay Area. And just noting that there seems to be a summer rise coming up. I think Peter Chin-Hong also had commented on.
Thank you, Commissioner, for your question. One, I just want to say, going back to the 120 beds quickly before I answer your question, is I think at DPH and all of us agree that these beds are very crucial to City and County of San Francisco. So it is disheartening to get this denial. But also to Commissioner Green's question, the regulation in itself, there is no time limit when you could apply for a waiver. There is no time bound on it. So that if at some point where team decides there may be an appropriate time to pursue this again, that could be done at any time. I just wanted to bring that to your attention. And going back to COVID, yes, a lot of this work is happening with the guidance from our IPC. We're really the experts in managing any type of outbreaks. And this work is in line with the industry standard. Yes, we understand there may be COVID surges, and it does happen seasonally as well, and it will continue to happen. And we are developing plans to ensure that if there is a surge, that we do have those plans in place as well. How would we manage those? All of that work is happening with the IPC team and will be approved by the appropriate people before we implement this plan.
So I think just as follow-up, during our regular monthly meetings, if you then keep us up to date on the number of COVID cases that there are at the hospital, that would be helpful to us.
Definitely. Thank you.
Okay, no further questions or comments? Okay, we can move on.
Sure. Thank you. We can move on to item 5, the senior affordable housing at Laguna Honda Hospital campus. Thank you.
Hello, commissioners. Hello, my name is Sharon Kristen. Good afternoon, President Green, commissioners, Director Tsai. Again, I'm Sharon Kristen, Senior Project Manager with Mercy Housing, and we're here for our July update to the JCC. The next slide, please. I am joined by Ann Romero from MOHCD. Today, we wanted to focus on updates to the preliminary site plan. I want to stress once again that this is still preliminary. We just wanted to provide you an update from what was shown previously back in March and April. We'll look at the draft parcel map, and then we'll review the next JCC meetings and our thoughts of what we cover next. Next slide, please. So the previous preliminary design was what we call faceted or a circular building. It included 2 phases, where phase 1 had 125 units, and it's to the south, the larger U to the south. The phases basically encircled the courtyard. The ECE, or Child Care Center, was in phase 1, and the Potential Adult Day Health Center was in phase 2. Although this former site plan was more spatially efficient, meaning we can get more units in a small square footage. In working with this selected general contractor, the faceted design added complexity to building the building and limited the construction types that we could use to build the building. So basically, concrete was the most efficient way to build a circular building, and that was pushing the cost up. So we were reevaluated. Next slide, please. And looking at trying to make basically get a similar number of units in a less expensive to build building. And the reason why we were going this way is we're not only monitoring federal funds, where there isn't very much update yet, except for the fact that we do expect that there's going to be cuts to the HUD budget. And the large bill that was passed in the last few weeks, it does include what's called the 25% test that will help to make tax credits and tax exempt bonds less competitive. It also will have, so due to the tax cuts and having bonds become less competitive, there'll be more bonds or credits available to buy. And we expect that the credit pricing will go down. These are all just dynamics going on in the marketplace right now. At the state level, we did hear that there will be a small amount of funds allocated to affordable housing capital loans next year, about 120 million, which would support about 4 projects. The state is still figuring out how they will allocate those funds, so it's to be determined if we'll be able to apply for them. But all of these factors are pushing us to look at trying to build the building with sort of the right size number of units at the most efficient cost per unit and the most efficient total construction cost. So we're not relying on state funds, and we basically can utilize the amount of MOH city funds that are available for this project. So what we've looked at doing is phase 1 now has 110 units. Right now it's shown as all 1 bedrooms, but we're studying possibly adding some studios or really replacing some ones with studios, which will allow us to basically shrink the footprint a little bit of the building. MOH City has asked us to look at adding studios or replacing ones with studios, because having some studios in senior housing is the most common mix of units in San Francisco. Phase 1 is still 7 stories, or 6 stories, excuse me, still 6 stories. Phase 2 stayed at 90 units, but we are looking at a mix of 1 bedrooms and studios, where previously, the previous site plan, they were all studios. We understand that some 1 bedrooms is likely a better unit type for people with mobility equipment or having a care worker working with them in their unit for a significant number of hours. So we feel, or we're understanding that a mix of studios and ones will be a workable unit mix for both an assisted living approach or an enhanced services approach. Since we're still working on what approach we're going to do, we want to make the building unit mix work for both. Since the rectilinear approach is less spatially efficient, we did go to 7 stories for the phase 2. So it's shown as 7 stories. But again, this is all preliminary. We're still trying to overall shrink the building to get the right unit mix and high quality units that'll be usable for the population that we intend to serve. For parking, we now have 31 spaces. It was previously 38. This is a large amount of parking for independent living senior housing, even with non-residential uses. So we have about 25 spaces that we are showing for potentially assisted living. And that was based on the previous consultant that we were working with on the assisted living approach. Felt like 90 units of assisted living typically would have about 25 parking spaces. For the other uses, the independent living senior housing, the ECE, the adult day health, we show about 2 spaces each. So that brings us to 31 spaces. And based on our experience working in San Francisco, that is enough parking for these uses, because residents do not usually own cars and staff are usually used to taking public transit to their workplace. Distance to the hospital. Next slide. Thank you, Mark. So these slides show the comparison of the previous site plan and the current site plan of the distance to the hospital. So I'll just run through them pretty quick. For the faceted, the face of the building was about 155 feet to the tall part of the northeast tower, and about 35 feet from the closest part of the northeast tower, or the connecting walkway. For the main part of the connecting walkway, it was about 50 feet away. And it was about 210 feet away from, as the crow flies, from the entrance. And the new building or the new preliminary site plan, all of those distances are a little further, about 190 feet for phase 2, 170 feet for phase 1 to the tall part of the tower, and about 5 to 15 feet for the shorter, closer for the shorter parts of the tower. And the distance from sort of the back part of the building to the entrance of Laguna Honda is roughly the same. Okay, so you can pass the next slide. And this is just a blow up, so it's a little bit easier to see. Next slide, please. And then the next slide, please. This is just a different perspective of the same distances. This is as if you were standing at the elevation of the Laguna Honda entrance, and you can see our site, the senior housing site is about 12 or 15 feet above that elevation of the entrance, and we're just repeating the distances there so you can see it. Next slide, please. And this is just sort of like if you're floating up in the air above Forest Hill, looking at what the site plan would look like. They're slightly a little off from each other. So you could see in Forest Hill Station, that is kind of the grounding, but the buildings are roughly the same size and roughly the same location. Next slide. We wanted to show this perspective of the planned third tower, which is again the site of the proposed senior housing. The planned third tower was to be about 103 feet, which is similar to the northeast tower. So the senior housing project is the phase 2 is about 30 feet shorter, and the phase 1 is about 20 feet shorter than that planned third tower. Next slide, please. The next slides are going to show a shadow study of the proposed rectilinear approach to the site plan to the northeast tower. And essentially, this demonstrates all the studies are going to show, or the first slide studies are going to show at 3 p.m. So you can see kind of the effect of the shadow at the different seasons. And what you can see is at the spring equinox and fall equinox, the current Laguna Honda Hospital at winter solstice. Ooh, I think we need to go to the slide, and I have to just look on the slide. I think I messed up my slides. So the first row is like the new senior housing is not there. So these are the shadows that are created by the northeast tower. The second slide just shows, the second row just shows spring equinox. Yeah, it just shows spring equinox. And so it shows that you can see that the shadow is basically going from, west to east, and it's almost touching the short part of the Laguna Honda Tower 2. If you go to the next slide, this shows 3 p.m. at each of the seasons. And so it's spring, we're just barely touching, summer, not touching, east, just barely touch, or fall, excuse me, just barely touching. And then winter is when the shadow of the phase 1 would touch kind of the outer wall of the east wing. Next slide, please. So this is our proposed parcel. We are working with our surveyor, and we'll also be meeting with the Department of Real Estate to go through the easements needed. But you can see that the parcel 2 is the senior housing parcel. This will be subdivided into 2 separate parcels, but it's about, the total parcel 2 is about 1.6 acres. The larger Laguna Honda, which will be the remainder after this parcel is subdivided, is about 73 acres. Next slide, please. And Anne was going to walk us through the next presentation.
Good evening, commissioners. My name is Anne Romero. I'm a senior project manager at MoCD. And I just wanted to preview the upcoming meetings, the topics that we're planning to present. And so in August, we would like to provide a draft memorandum of understanding between MoCD, DPH and Laguna Honda and Mercy Housing outlining the roles and responsibilities as this project gets developed, as well as provide an update on the services planning for phase 2. We will be at the point that we can present that to you. Then in September, we'd like to request an endorsement of approval of the memorandum of understanding, taking into account all of the feedback that you provide. In October, we would like to review the options for the project site ownership, and that is if DPH would maintain site ownership of the land or make a jurisdictional transfer to MoCD for the site underneath the housing parcels and the pros and cons. Then in November, we would like to bring this to the JCC and the full Health Commission, both the site ownership and approval of the memorandum of understanding. And that is so that in 2026, Mercy could move forward with funding applications for tax credits and bond financing. Then in 2026 and 2027, we would continue to do periodic updates. So now Sharon can finish the presentation. Thank you.
Yeah, we led with some of the funding updates that are driving our approach to the site plan. So those are the main updates that we have at this point regarding funding. For tariffs, it's still unknown the impact because frankly, they need to settle down. There's been such changes about what tariffs are going to be. I think it's getting a little bit clearer, so we'll be able to make some plans with the contractor to create contingencies for how to mitigate the impact of tariffs. But we probably maybe in one of those future updates, we can bring the impact to tariffs. And the next, questions.
Okay, thank you for your presentation. Is there public comment?
Is there public comment in the room on this item? I see no one in the room, but I do see a hand remotely. Mr. Manette-Shaw, you've got 3 minutes.
Thank you, Mark.
The June 23rd biweekly LHH MOHCD Mercy Housing Coordination Meeting for this housing project included an 11-page presentation that falsely asserted on slide 7 both the Phase 1 senior housing building and the Phase 2 assisted living building would each be 6 stories. That appears to have been misinformation because today's presentation claims the Phase 1 building will be 6 stories and the Phase 2 assisted living building will be 7 stories. Will the number of stories and Mercy's shifting estimates keep changing as they inch toward seeking this commission's final approval? Here it is just a month before this JCC will be asked to approve an MOU for this project in August, but 2 important issues haven't been addressed. The first concerns the need for the child care center, since Mercy remains unsure of when to conduct such a survey. Mercy and LHH have not conducted a survey of LHH staff to assess the need for child care, since Mercy was awarded this contract 6 years ago in 2019. The second issue involves how many of the units in each phase of the project are reserved for LHH residents, and why residents receive a set-aside for a guaranteed number of units. The June 23rd biweekly meeting notes discussed the need for the ideal number of LHH placements from patient discharges, but didn't provide an estimated number of units needed. This suggests that Mercy Housing must make more frequent presentations to the LHH JCC and the Health Commission more than just once per month. Mercy's February 3rd presentation to this LHH JCC set up to an estimated 170 senior independent living units would be built in Phase 1. Now, just 5 short months later, Mercy is saying only 110 independent living units may be built in Phase 1. That represents a scope reduction of 35.3%. A May 19, 2025 Mercy schematic presented to a biweekly planning meeting indicated 34 units will potentially be eliminated, reduced to 110. Commissioner Guillermo falsely asserted it's a small decrease, not significantly changing planned units. Cutting 34 units to 110 is a significant 24.3% project scope reduction. If Phase 2 is eliminated due to lack of funds, and the planned 214 total units are cut to just 110 units across both phases, that represents a 48.6% scope reduction. How many units will realistically be built? Before this JCC considers approving the draft MOU in August or September, Mercy needs to commit to the actual number of units that will be built. To the extent reality is still relevant to the Health Commission's authority over this housing project, don't forget this commission sought guidance before adopting the non-binding term sheet in March doesn't prevent you from terminating this project. You should terminate it now. I've been expecting you do something to terminate the project as inappropriate for senior housing, but I probably shouldn't hold my breath. Thank you.
Right, that ends public comment for this item.
Thank you. Any additional comments or questions from members? No. Okay. Commissioner Chow?
So thank you for the new information and especially the changes that you're all looking at. And of course, in any project, there are always a number of changes. And it sounds like you've given a good rationale for going from a circular to a square building or rectangular building. Actually, it almost looks better. Considering all the other buildings are rectangular also. But aside from that, and maybe because of it, I guess we're still struggling as you've now separated out fairly clearly two different projects really going on. One is independent living, and then the other is the assisted living, which of course from a standpoint of the medical continuum, we'd be much more needing to see that this could be something of benefit to the city and to potential Laguna Honda residents who could then go down the next step. I guess I'm still not clear exactly why we are still putting the adult center and that particular project later. Now, I understand that we're talking about a lot of funding, but the funding is already iffy enough for this portion of it. What are the possible sources of funding to maybe flip this and develop the assisted living and adult center before the senior housing? I mean, you're talking about building the senior housing before the assisted living. And I'm saying you could either build them both together, but you've indicated there are challenges there. You've chosen to present the independent senior living versus the assisted as being the first phase and the second phase, and almost said, I think in one of the meetings, you're not sure you're even going to get to the second phase. And so our interest here, or mine anyway, is I'd like to see more assisted living type space and an adult center really take root in our campus there. So could someone help us understand again, aside from saying there's more money over here than there, because if we don't look for money over there, then we'll never get it anyway.
Yes, hi, this is Ann Romero with MoCD. So the reason why we have proposed the affordable housing to be in the first phase is because that is a known financing model, and we are still working on the model for the phase two. We're very relieved that there might be this small state notice of funding availability next year so that that can be applied for. And meanwhile, as we continue to develop the model for phase two. So that is essentially why we are proposing, so that we can start developing one of these projects as soon as possible as the other one is getting financed.
Could you sort of write or propose a timeline in which you would, in terms of looking at funding? I mean, we've got timelines looking at construction and all, but telling us these are funds that now that you say the state is coming in with, and that we have great opportunity to do for senior housing versus what you see are opportunities then for assisted living and what sort of phase, because regardless of when you're looking for the assisted living, I'm sort of concerned that we don't seem to be on a dual track looking for assisted living at the same time that
Right.
we're looking for the
And-
housing.
Yes, and next month, we will be providing an update on the potential service models for the JCC consideration, and that would include the financing models. But right now, we are looking with our consultants and with all of the stakeholders about what are the greatest needs, how could this development best serve Laguna Honda Hospital and the healthcare system in San Francisco. So that work is going on. And we will be ready to present potential service models to you at the next month presentation.
So will that give us the sort of the information I was talking about as a
Right, as well
layperson?
as financing possibilities.
Okay. Then you're also talking about an MOU of some sort, certainly to, speak about a proposal, and we've already voted to say that we think this is a good idea. I'm wondering, when would you like to discuss, or how are we going to discuss the issue of lease versus transfer of the property? My preference, looking at the diagram now, and even more strongly, is I think from my perspective, it would be better leasing rather than turning over the whole property, because you're right in the middle of Laguna's property. And if you turn over the property and ultimately you don't build, then you have to go through getting this all back in another title type thing and so forth.
Right,
and So I think we should have that discussion also at some point as to how the department feels about that, because you would still have the land to build on, but if you don't build on it, then it was leased land and we have less complications, seems to me, having the department then be able to use the land rather than getting a transfer again of title and so.
yes, most definitely. And what we're proposing is to present the options at the October meeting. And because the affordable housing parcels will actually be in two separate parcels, they could be transferred first when we know parcel one is moving forward and what is that model for which agency owns the land underneath phase one, and then phase two could follow, or both could be done at once. But we are planning to present that at the October meeting.
Well, you're going to present it to the full commission in October is what you're saying.
I believe it is to the JCC in October.
Well,
And then vote in November at the full commission.
Yes, and then to be followed by the full commission in November.
And if I may, part of the delay,
okay.
Commissioner Chow, is that the city attorney is taking a little time to develop the options and making sure that they're going through the document. So that's why it's not happening in August, it's happening in October, that particular part of the discussion.
Okay, well, I think the problem there is that if we're presented at the JCC in October and we have some issues, I'm not sure they could be clarified by the time you're asking for a November.
Well, it'll come before the JCC again in November before the full commission votes. So you'll have it in October as a draft, and then November you'll have the JCC, and then the full commission will vote. I mean, it's
So
scheduled.
we're going to have two hearings on this. I mean, possible
Right.
presentations, right? Because
Well, it'll be, oh, I'm sorry, it's okay, I'm
No,
jumping in.
yes,
yeah, I don't think you can just present a plan and then 2 weeks later we go to the commission.
Right.
I
That's not the
mean, it'd be
timeline.
wonderful if we could, and it met everybody's requirements, but considering that these things take a while to understand, not being lawyers, at least I'm not, it would be good to be able to then have a second meeting there
Right.
before we go to the commission.
Right, that is why I said, so you'll have one meeting to introduce it, you'll have another JCC meeting to discuss it and decide if you're going to recommend it to the full commission. And then it will be 2 weeks later that the full commission will meet.
Okay.
So we'll have to play it by ear to see if y'all are comfortable with that, but you do have a little time to.
Yeah,
you know,
I
get
want to be
feedback
sure that
and
we
then-
have a chance to have a second meeting after the presentation. Okay.
President Green.
Well, first off, thank you for really being nimble and updating these things. You know, it's so clear that you need to be able to pivot according to, new information. I don't think we've been through a time where there's been this much uncertainty. So I really appreciate that you would not only give us a sense for where funding might come, but, as we've looked at other presentations for construction throughout the department, there are typically costs that exceed expectations for all host of reasons, including when COVID was happening and there was such a shortage of supplies. I don't know the extent to which or when you might be able to look at the tariff situation. As, for example, you said you're pivoting from concrete. Do you have any sense of how, there's sort of two components. One is where would the funding come from? And two is where will the cost change as time goes on? Do you have any sense of when, you might know more about construction costs?
Yeah, we're actively cost estimating as we come up with new site plans. So every time we come up with a new site plan, we cost estimate. I think what's difficult is that the tariffs literally are changing day to day. So we keep on asking the contractor, how are we going to incorporate the impact of tariffs? And they haven't really settled down enough. So I think at some point, like literally, really, we would have to, put a contingency or put some kind of sort of limit of what tariffs ultimately how they could impact the project as late as when it bid to subcontractors. So that is when we would really define the overall maximum cost of the project. And that would be what we would enter into contract with for the contractor. So what other projects have done at this time is they've looked at all the different materials, because it's mostly materials that are being affected by tariffs. And they basically look at what are the potential or proposed tariffs and basically put a little, dollar amount to how all of these various materials could be affected given the proposed tariffs. And then they look at how much dollar amount that is and kind of make a decision about how much they're going to include in the contract. And it's included in the contract as basically an allowance. So it can be used if it's needed. And if it's not needed, it's returned to the owner and all savings is returned to the city. So that's how other projects have been managing it. But really it would be defined at the time we go to bid and then we go to contract. And I think we should know more about what the tariffs are, but projects that are going to bid and contract now, that's how they've been handling it.
Well, thank you. And then is there a different source of funding for the child care center compared to the rest of the project? I think I saw in the answers, I didn't have time to read them all, that maybe one of the reasons that that's in phase one is that there's some
there is,
more guaranteed funding. Can you?
Yeah, LIF will pay for its tenant improvements. So they do, is it a loan? Is it a grant to the operator? And that helps the operator fund the tenant improvements. And then MOHCD will pay for the shell of it. Like, its foundation, its exterior walls, its, basic shell of the ECE will be paid for as part of the MOHCD loan. So in terms of its funding being more certain, I think LIF has those funds allocated for this center, is my understanding. So yeah, its funding is a little bit more certain.
And then I think this is a question maybe that for Laguna, which is, now that we know we're not going to get our 120 beds in the near term, I mean, maybe we'll get them by 2029. I'm just wondering if we have any sense for the number of Laguna residents that might qualify for just independent living versus those that would need assisted living. Because, as we're trying to figure out how we're going to really help the Laguna community and the community in general, those kinds of questions I think would be pertinent.
Thank you, Dr. Green. Roland Pickens, Director and CEO of the San Francisco Health Network and executive sponsor on this MOHCD project. So to address your question and that of Dr. Chow, in terms of how many residents, we've given preliminary data to the Mercy team. We meet bi-weekly. We met today. There are some additional follow-ups in terms of to better understand what those numbers might be. You've heard them mention their consultants. So they are working with HMA. Through the discovery process, we've widened their key informant interview process to include other parts of the department, including behavioral health services, including the public guardian, Zuckerberg San Francisco General, because again, we see this as a resource not only for Laguna, but for all the needs of San Francisco. So as we do this additional fact finding, we'll be able to hone in more on how many residents do we think, not only within Laguna, but within our system, because we have people that's sitting in beds at San Francisco General, The public conservator has patients who potentially could go into these beds. So we'll put all that together with the Mercy team and bring those numbers back. In terms of Dr. Chow, your concern about the jurisdictional transfer versus lease, just to assure you, this has been an issue that we've raised from the very beginning. And we at the DPH and Laguna Honda level are working with the city attorney, both for DPH, the city attorney for MOHCD, and the city real estate department to look at what are the various pros and cons. As they stated, there will be many discussions before that's brought back to you that include Director Tsai and DPH leadership, so that there'll be a more informed process, so that it won't just be dumped on you in October. There will be many discussions and review and deliberations over what might be the best options.
Okay, well, that was really helpful to hear from Laguna Honda in response to your questions. And this is sort of a new and complex issue project that we're embarking on, but at the same time, it holds significance because it's kind of a microcosm what's happening at Laguna Honda of what the needs are across the city and the area. And so there is a lot of the questions that we're asking aren't relevant just to what happens with the unique situation, of the possibility of Laguna Honda and affordable housing occupying the same geography, but how do we, as responsible leaders, think about those issues for all of the residents of San Francisco, and the opportunities and lack of opportunities to coordinate these kinds of needs from children to seniors and all across. So the amount of time, and given that this is not a commission that has dealt with land use issues in this way, I think the education that we're getting across this set of meetings and fact finding and deliberation and policy is really something that it's important for us to take our time and really understand and take on the responsibility and fulfill the responsibility that we have. So I appreciate Mercy Housing, MOCD, Laguna Honda, the network, the department, doing what you're doing to really address all of the concerns. And remember that we still have to bring this to the full commission, who have had less exposure. And so I think we, as a JCC, we feel more responsible in ways to ask the questions on behalf of the full commission and those at Laguna and in the city that I represent. So I appreciate the response, the patience, and really showing up for us at all of these meetings. So we can move on.
Thank you. Item 6 is a hiring and vacancy report. And Ms. Thornton will be presenting remotely.
Good afternoon, commissioners. Can you hear me okay?
Yes, we can see and hear you well.
Great. Thank you. Good afternoon, all. Thank you for making some time today to hear a little bit about what we got going on in HR. As an update, our current vacancy rate at Laguna Honda.
I'm sorry, Erica, your sound was great at first and now it's not so great. Can you either speak up or get closer to the microphone?
I'll use more of my outside voice. Happy to do that. And please, thank you, Mark, for letting me know. Please just jump in if I tend to taper off a little bit. Our current vacancy rate at Laguna Honda is at a 2.4%. That's including our attrition. We hired a total of 15 folks in June. Of those 15, 11 were new hires, 2 were transfers, and 2 were rehires. We had 1 non-retirement separation during the month of June, and 3 of those 15 hires were registered nurses. Our RN vacancy rate is at a 4.6%, which is 8.6 FTE of RNs available, or open, I should say, at Laguna Honda. We continue to hold regular standing meetings with Laguna leadership to discuss hiring needs, to discuss strategy, to ensure that we're bringing the right folks on board to Laguna to support the needs of our residents. We also have been working very closely with our data team to ensure that we're connecting our data points with where is it causing a bottleneck? Are we having issues with our data that can in turn impact our hiring needs? So we're working very closely with our data team on that to ensure that we can make sure that our process continues to flow smoothly and quickly for both candidates and hiring managers. Also, I believe that we've mentioned this in previous JCC reports, is that recently the HR team, the operations team in human resources restructured, where now we have a dedicated hiring and selection team, a dedicated onboarding and offboarding team, an employment services team, so that the hiring and selection team, which I lead, can really narrowly focus in on getting candidates through the process and selected in a much more timely manner to fill the needs at Laguna Honda across the network as a whole, actually. And lastly, and thank you, Commissioner Chow, for mentioning around our HR platform that we are looking at implementing. We're in the very early stages. We're calling it HRISE, and it's a platform that will overtake our current HRIMS access, which is bringing us into the 21st century from a data perspective around human resources. Commissioner, you would ask the question around how will this help with expediting hiring. How it impacts hiring directly is that it integrates systems. So it takes away a lot of our manual processes that we're doing today that bogs down the hiring analysts as well as our hiring managers in administrative minutia that now it will be able to automate itself and move through much more smoothly, which in turn gives us on the back end a better result for some data, which is really exciting for us. And then one last thing I did want to make sure that I called out is that we wrapped up just about a month ago, our employee engagement survey, and we should have those results in the coming weeks, which in turn we will end up sharing out with leaders across the Department of Public Health so that we can implement strategies to help improve the workplace for our employees. And I will pause there. Are there any questions that I may be able to answer?
Thank you. Can we see if there's any public comment?
Is there any public comment in the room on this item? I see none, but I do see a hand remotely. Mr. Mitchell, would you like to make comment on this item?
I would. Thank you, Mark.
Okay, you've got 3 minutes.
It's worrisome seeing on the June vacancy report by FTE that LHH's registered nurse vacancy rate has only decreased by filling one RN position, with 18 vacancies still outstanding in job class 2320, and the licensed vocational nurse vacancies have also decreased by just one, with 25.65 vacant job class 2312 LVN vacancies unfilled. Similarly, there has been a reduction in job class number 2303, certified nursing assistant, with 33 vacant CNA positions yet unfilled. Across the 3 job classifications, there were 79.655 vacancies in May, and the 3 new hires have reduced the vacancies across those 3 job classifications to a whopping 76.65 positions still vacant. Why is LHH having such trouble recruiting for and hiring direct patient care nursing staff to onboard? As well, between May and June, the vacancies for job class 2302, nursing assistant, aka patient care assistant, has remained unchanged at 23.10 vacancies, bringing total vacancies for bedside care nursing staff to 99. As I testified last month, this report, ostensibly prepared in Microsoft Excel, had displayed column totals for the budgeted FTEs, utilized FTEs, and vacant FTE columns on the last page throughout the 26-month decertification period between April 2022 and June 2024. That totals line clearly displayed the totals across all LHH job classification codes for each of the 3 FTE column categories. Why has the HR department suddenly stopped including the totals row on the last page? Who directed them to change the format of this report by removing key statistics meant for the LHH JCC Commissioner's easy edification by eliminating using an easy-to-use automatic calculation, beginner's level feature in Excel? Do staff need training in using Excel's AutoSum icon tool? Thank you.
That ends public comment for this item.
Questions from members? Then, okay, thank you. Move on.
All right, we can move on to item 7, the regulatory affairs report.
Right. Good afternoon, Commissioners. My name is Carmen Trin. I'm the Director of Performance Improvement, and I will be presenting the Regulatory Affairs Report today. So during the month of June 2025, LHH submitted a total of 15 facility reported incidents to CDPH, and 10 anonymous complaints were shared by CDPH. CDPH has not started the investigation for the 16 fries. There were 2 site visits that occurred in June 2025. CDPH investigated 9 fries and 10 anonymous complaints. The facility received 2 deficiencies for 2 of the fries. The facility also received 0 deficiencies for the 7 fries. For the 10 anonymous complaints, 7 were investigated with no deficiencies, while 3 anonymous complaints were investigated with the outcome pending from CDPH. The facility was informed on June 13th, 2025, that the CDPH approved the plans of corrections for both the health inspection and fire life safety surveys. The facility also received approval for its informal dispute resolution, IDR, by CDPH, which resulted in F801 qualified dietary staff being removed from the CMS 2567 statement of deficiencies for the facility. At the time of the report, 46 cases remain pending for investigation by CDPH. I'm happy to take questions and comments.
Thank you. Public comment?
Any public comment in the room? Carmen, please come on up. Could you please step aside so he can? Yeah.
My name is Jim McAfee. I'd like to emphasize this report just a little bit here. 12 allegations of abuse. Injury of unknown origin, 1. Investigation not started by CDPH. Other to resident, 1. Investigation not started by CDPH. Resident to resident, allegation of abuse, 5. 5 investigations not started by CDPH. Staff to resident allegations, 4. 4 investigations not started by CDPH. Misappropriation of residents' property, 1. 1 investigation not started by CDPH. For other reportable incidents, major injury, 2. 2 investigations not started by CDPH. Disease outbreak, 1. 1 investigation not started by CDPH. Potential privacy breach, 1. 1 investigation not started by CDPH. 10 anonymous complaints. 10, 7, it says here 7 no deficiencies. 3 pending outcomes. Evidently they investigated. Notice that it says 7 out of the 10. There were no deficiencies. Now, these are similar reports every time you guys give one. You know what I mean? These things are never investigated. You're not going to read the next time there's a report that these that were not investigated were investigated. You're going to get a whole new round of stuff that's alleged that isn't investigated. And if you don't believe me, I'll go back and collect copies of these things and bring them back, and we could review however many months it takes for people to realize that there are not investigations happening. This is called a cover-up. I notice that nobody wants to look at me and nobody wants to acknowledge it, but this is what it says right here. No investigations, no investigations, no investigations, no investigations. Now, what are you guys doing here? Now, I know about this kind of stuff because my domestic partner and myself are caught up in this type of audacious behavior. The only thing worse than having allegations about Laguna Honda that you can't prove is having allegations about Laguna Honda that you got plenty of evidence for. I'm not the only person in this room who knows what I'm talking about. Please pay attention to the fact that these reports say time after time that there are no investigations. And in the future, you will find out that these were not investigated. And this is what happens month after month after month. This is not justice. This is not what a commission should be just signing off on. Thank you.
All right, and we have a hand, I believe, remotely. Yes. Mr. Minuteshaw, do you want to make comment on this item?
Yes, please.
All right, please begin. You got 3
It's
minutes.
sad to see today's Regulatory Affairs report shows LHH racked up 10 additional anonymous complaints in June. That pushes anonymous complaints for the first 6 months of 2025 to a total of 26, compared to 37 anonymous complaints for all 12 months of 2024. LHH has had 12 major injuries in the first 6 months of 2025, up from 8 in all of 2024, and just 5 in all of 2022. LHH has had 29 resident-to-resident abuse FRIs in the first 6 months of 2025, compared to 46 in all of 2024, suggesting patients being admitted are again turning combative. There have been 6 disease outbreaks in the first 6 months of 2025, compared to 8 disease outbreaks for all of 2024, and 10 disease outbreaks for all of 2023, suggesting a return to insufficient nursing infection prevention efforts again. There have been 3 potential privacy breaches in the first 6 months of 2025, compared to 3 for all of 2024 and 3 in 2023. While the Regulatory Affairs report shows 0 AWOL/AMA FRIs for the first 6 months of 2025, the State of the Hospital slide in the Executive Team report shows 5 AWOL/AMAs in 2025. Why does the Regulatory Affairs report not include the 5 AWOLs reported on the State of the Hospital slide? Why is there this discrepancy between the 2 reports? And do the 5 AWOLs included in the unplanned discharges suggest that admissions to LHH are again returning to admitting patients who decide they don't want to stay at LHH because of the quality of care they are receiving at LHH? As I just noted, LHH has racked up 704 FRIs between January 1st, 2021 and today's date, for an average of 201 FRIs annually. Directors, I should direct LHH's QM department to analyze how many of the 704 FRIs were not sustained, to see if the 120-bed waiver denial could be appealed based on a much lower number of actual sustained facility-reported incidents. Still, it's very disturbing the 120 beds were apparently grandfathered and should never have been closed. Had LHH staff been doing their jobs properly, LHH would never have been decertified at all and subsequently lost the 120 beds. There has been no accountability around LHH staff being ultimately responsible for the potential permanent loss of these 120 beds. This all stems from the patient sexual abuse scandal in 2019 under former CEO Mivek Hirose. Thank you.
That ends public comment for this item.
Okay, any additional questions or comments from members? Yes, Dr. Chow.
Yes.
I just think that I wanted to thank the new reports that show that, for example, on our outcomes on the fries, considering several years ago when we were literally years behind, that the state has been much more responsive to these investigations. And more importantly, if you look on the report that we're seeing of the many that were seen and investigated, there were only 1, 2, 3 problems of deficiency, and all the other FRI outcomes that have been reviewed have all been with a positive finding, no deficiencies. Very importantly, under the staff to resident, complaints that have been made, again, these complaints have been found to be invalid. So I think it is valid for us to actually, when the time is right, challenge the authorities in CMS as to what type of complaints do they think they're looking at. All of our anonymous complaints thus far for the past year have also shown that there have been no deficiencies. So I think the data has improved over the year, and I want to thank you for the clarity of the update that you provide to us each month.
Thank you.
Yes, well, thank you for the report. And I think I understand this, but can you clarify the rate at which we receive anonymous complaints has nothing to do with the actual timing that the complaint goes to CDPH. It's when CDPH decides they are going to inform us about the complaint. Because I know I've asked before that it seems to go up and down, and it doesn't necessarily correlate perfectly with the episode itself that yielded the complaint. Is that true?
Thank you for your question, Commissioner. Yes, we only find out of these allegations of the complaints when we actually either get a phone call or there's a visit from CDPH in opening that case. That's the time we find out. And sometimes these are actually complaints tied to a fry in itself as well. But they're investigated when they visit. So we only find out when they're informed.
Yeah, thank you. And then also, obviously, when you submit a fry, you've thought about it. And can you just reiterate the process you use? I mean, you pick up one of these concerns, you report them, but obviously internally you're already sifting through, what requires immediate action and what, in other words, we don't just sit still until an investigation begins. Can you just elaborate a little bit on what you do is you try to parse these and figure out which might, be of concern and require corrective action, which might not be as valid?
Yes, thank you. Anytime there's an allegation of abuse or mistreatment or misappropriation, we take it very seriously. There is a reporting time frame. It's reported usually within 2 hours of finding out. In some cases, it's 24 hours, depending on whether it's misappropriation or abuse. Once we do find out, we are supposed to act immediately, and we do, making sure the patients are kept safe. And we have 5 business days to ensure and complete the investigation, a thorough investigation, and then send a follow-up letter to CDPH informing of the conclusion of that investigation. And that concludes the internal process in it as far as to that incident. And then on top of that, CDPH will, depending on their bandwidth, will come in and investigate that incident. And then we will have a final outcome from them, whether they substantiate or unsubstantiate and issue a deficiency or not at that point.
And I mean, given the structure that you put in place and the leadership now, have you ever been surprised by a deficiency in the recent few months that or CDPH finds something and you hadn't, through your own investigations, anticipated that there could be one?
I don't recall any such incident. Usually, especially if we have investigated something, we're pretty well gone through the whole case, and we are aware if there are any vulnerabilities where a facility could be cited. And most of the time, we are probably an outcome is the same as what CDPH may decide as well. An anonymous complaint, it could be a surprise because we don't know what that complaint could be in regards to. And many times, even during the investigation, they don't often tell us who may have complained and who this may be in regards to which patient. Those are truly anonymous. They will select a sample and investigate, and we will only find out at the time of the outcome of that investigation.
Well, thank you, because I think it's important for us to hear that you are ahead of the process rather than, I mean, we've had great frustration when we piled up so many pending investigations that they were getting into the hundreds. And it's just good to know that you're way ahead of the curve in terms of instituting any corrective action plan that you might see needed when there is something that comes up that's of great seriousness, but also that, this is not something we wait around for CDPH to tell us. We are very proactive, to the contrary. So thank you so much.
Yeah, thank you.
Okay, we can move on.
Thank you. We can move on to, item 8, Laguna Honda Hospital Policies. And this is an action item.
Yes, Carmen Trin, Director of Performance Improvement. Tonight, the facility will be presenting 15 policies for review and consideration for approval, 2 facility policies recommended for revision, 12 departmental policies recommended for revision, and 1 departmental policy recommended for deletion. Thank you for your comments and your questions today. Happy to take more.
Your public comment?
Is there any public comment in the room on this item? I do not see, and there are no hands remotely.
Sorry, you said no hands?
No hands.
Okay. Any additional, I know that there were quite a few questions and comments, and we've received responses, but just want to make sure that you've had a chance to review them all, and if not, to bring them up here. Yes, Commissioner Fah.
I think just for a point of information for the committee that when we put in the end of life option program, we were wondering how much it was going to be accepted, and staff has indicated that there's only been one case. But it's well written and apparently now aligns with the state. I just sort of wonder, but you don't have to answer that this policy is in place since November 11. Since 2017, there was a revision, and there have been revisions going on. So I'm not quite sure that the act guidelines change, that we now continue to correct it, or did we not really parallel the state in the beginning? I don't know if Dr. Lamb will know the answer because he wasn't here at that time.
Hi, good evening, Commissioners. Albert Lamb, Chief Medical Officer here at Laguna Honda Hospital. Regarding the End of Life Option Act, you're right, I was not here during previous revisions. However, I will share that we continue to refine the policy so that for clarity, what may have seemed clear at a time in which there was much more discussion, later on as we review it, may need refreshing. In this case, what we wanted to do is we wanted to align more closely with the verbiage of the statute. And then we also wanted to maintain internal consistency with the wording that we used. We've also implemented a definition section to allow us to make sure that we know what we're talking about when we use certain terms.
No, thank you. I think it's a job well done, and I got the feeling that it was trying to align it, and a little disappointed that we had not actually aligned it earlier. That's all.
Thank you.
Yes, President Green.
Well, thank you for all the responses. I really appreciate it. I think the only thing that continues to confuse me on the wording is the monitoring behavior and effective psychotropic medications, because the second paragraph here, all psychotropics ordered by the provider, as well as any medications used as a substitution, shall be accompanied by a target behavior. And I think that can be interpreted in many ways, as I put in my question. So I'm just wondering, to say it's accompanied by a target behavior, you're not really, that's not what you're trying to say. You're trying to say that if you prescribe a psychotropic drug, you want to see how that drug has a positive or a deleterious effect on the behavior you're trying to correct or that you are viewing. So I'm just accompanied by a target behavior just doesn't, I'm not sure it's, and I understand the policy later clarifies it more, but it is kind of confusing way of wording it. It was new wording, and that's why I wanted to bring it up.
I don't know if there's someone on the team who is closer to this, but I can certainly offer my explanation. Target behavior is a term of art in nursing facilities. It's generally what is used to describe the specific, as you explained, the specific behavior that we're targeting for that medication. It's a little bit different than the indication, which is the diagnosis. It's actually the manifestation of the diagnosis that we're treating.
I think that what I'm confused with is shall be accompanied by. Accompanied is just a word. Because
I hear what you're saying.
Trying to say. I mean, you might want to think about the wording there. There's even something here that I think you wrote that sounds fine. You know, also psychotropic drugs have been prescribed, should be identified in therapeutic effects on target behaviors and any side effects of each drug recorded. That to me sounds so much more logical and clear than to say it's accompanied. So just a thought there, because I think this is really important. I mean, this is so critical to managing the patients that we have.
If I may, someone's raised their hand. I don't know the name. Could you respond if you've got something relevant to say? Excuse me.
Hi, yes, hi, this is Zobag Manassian. I'm the new Chief of Staff at Laguna Honda. I can respond to the question about the target behavior. What it should say is it should be accompanied by an order indicating the target behavior.
Okay.
What it's doing is that every psychotropic has with it an order in the chart that identifies the target behaviors that that psychotropic is targeting and that the nursing staff should look for and monitor and document responses to. So that's why it's confusing. I agree with you. It's just missing the piece that says accompanied by an order for a target behavior.
Yeah, that makes sense. Then, so maybe we can approve this with that addition.
Thank you.
Thank you.
Thanks.
Okay, so with that addition prior to the full commission's approval, can we have a motion to recommend?
So moved.
Second?
Okay, all those in favor?
Aye.
Thank you very much. We can move on to item 9, a consideration for closed session.
Okay, can we have a motion for closed?
Motion for closed session.
Second.
And I'll just see any public comment in the room. I don't see. Let me make sure there's no public comment. No public comment remotely either. Folks, once the vote is taken, know that we will not be seen or heard during closed session, but commissioners, please continue to your vote.
All those in favor?
Aye.
Great. Please give me 30 seconds to take us there. We will be back in open session after closed session.
So foggy.
Okay, we're back in open session. Commissioners, you in closed session, you approved the credentials report and the PIPS minutes report. Would you like to consider a motion to disclose or not disclose discussions held in closed session?
I move not to disclose.
A second.
Discussion.
Okay, all those in favor?
Aye.
All right, thank you. And now consideration for adjournment.
I move to adjourn.
Second.
All those in favor?
Aye.
Aye.
Thank you, everyone.
Thank you all. Thank you, everybody.